He goes by Mr. BBL.
Dr.
Dr.
BBL.
BBL.
Dr. BBL. Oh, yeah, Mr. BBL is crazy.
I was saying that
My bad.
earlier.
I would pause myself,
I kept
man.
saying Mr.
Yeah, Mr. BBL is wild. But we got Dr. BBL in the building. Welcome, sir.
Thank you.
Appreciate you coming.
Real doctor here, too.
Real doctor.
Real doctor.
Yes.
Not a fake doctor.
No.
He got degrees and
I got degrees.
and stuff.
Got experience.
Well, you can
Wait,
introduce
do you know some fake
yourself
doctors?
too.
I do know some fake doctors, too.
Yeah, we'll get to that later. Yeah, let's get to it. Let the people know, what do you do?
Oh, yeah. So I'm known as Dr. BBL on Instagram. I've been doing cosmetic surgery for about 13 years.
Yeah.
Known for BBLs, Brazilian butt lifts, taking fat from the stomach, sides, back, and adding to the buttock and hips, giving a nice hourglass shape. Do men, do women, transgender. Mainly my specialty is liposuction and the fat transfer. But we do other things: lasers, tattoo removal, microneedling, facial treatments, skin tightening. I do use a permanent filler to enhance curves, hips, butt, but I also use a permanent filler to give men thickness. And
In
thickness.
certain regions.
Certain regions, yeah.
Sure.
Certain desired regions.
So-
And just kind of hinging on their discussion of what do men seek. And men seek, a few things. Men are very humble. I think men are also very scared in seeking aesthetic treatments for themselves. But yeah, we enhance the penis.
Yeah. So it's
Yeah, I got
real.
a bunch of questions on
People
that.
can do that.
You can do
So
that.
how does that work necessarily?
Yeah,
Like, is
so
it like fat transfer? Is
That's
some of
an
that
option.
nature?
yep. So men, I think, don't understand. Men only think about their length.
Sure.
Right.
And that's a misconception that length is going to satisfy their partner.
Right.
There's
It's-
definitely the girth part of it.
Definitely the girth part, I think
Yeah.
men leave out. That thickness is really where it's at. If you ask and survey 100 women,
Sure.
they're going to ask them, what's more important to you, length or girth? Many are going to say both. But
Yeah.
if they only get two choices, 80% will say girth.
Mm.
And the reason why is you got to think about the woman and the canal,
Of course.
right? Their canal is only so long, 3 to 5 inches.
Yeah.
So if you got 3 to 5 inches of pee-pee, you're actually pretty good. Okay?
Yo.
Anything extra than that,
I appreciate the education.
anything extra than that is just a waste.
Yeah.
Right?
Some
Now
women
it's
throw
just
out
being
crazy
extra.
numbers now these
Yes.
days, 8s, 9s,
Right.
10s.
And
you
you'll
know what
see
I'm
that,
saying?
right?
Yeah.
I think they like it just to look at and
Right.
to...
It's eye candy for them.
It's eye candy,
But
right?
it don't really matter.
It
at the
don't
end of
really
the day,
matter
right?
as far as pleasure.
Yeah.
Okay? Girth is where it's at. So let's talk about averages.
All right.
I don't think many men know what average is.
I hear whatever,
Yeah.
when we hear like other podcasts talk about,
Okay, what is it?
people-
Is it like 3.5 or something?
3 to 5, right?
So average length
Uh-huh.
erect, so when you're hard,
Yeah.
is 5.1 inches.
That's average.
That's average.
Okay.
There's men way above, there's men way under.
Right.
Yeah.
Okay? When we talk about girth, and most guys don't understand what the concept of girth is. You got to think of what circumference of a circle is, right?
Yeah.
Right.
That's around.
Mm-hmm.
4.5 inches erect is average.
Mm.
So what does that equate to? It probably is equating to maybe 2 fingers together is 4.5 inches. Now, that's the average. There's men above it and below it. When I do an enhancement and I want a man to be optimized, we're shooting for above 6 inches of girth.
Mm.
Yeah.
When he's above, right. When
That's
he's,
thick, pause.
right. Yeah, big pause.
so
Yeah.
when he's above 6 inches of girth, he's at the 99th percentile.
Now he's a legend.
He's a legend.
Legendary.
Damn.
He's going to be remembered.
In how many minutes can people be turned from regular or average to
so
legend status?
This is the beautiful thing about this procedure.
Yeah.
The men are awake, okay?
That's
They're
You can
watching
be awake.
TV, they're talking to me, they're listening to music. Some of them are falling asleep.
really?
And I do a penile block. So there's nerves located in the pelvis
Yeah.
that I can target with just injections, knock it out. You can't even feel anything.
What?
Once it's knocked out, I literally can take a hammer and beat it, and you won't feel it. And it allows me to work to create volume in the shaft
Yeah.
and even the head of the penis to make it thicker.
So
Yo,
with
that's
this
crazy.
procedure, is it any like after effects, any erectile dysfunction?
There's no
Any of
erectile
that.
dysfunction. There's no change in sensation. We actually tell guys initially you might feel enhanced sensation because you got to think those nerve endings are now spread out.
Right.
There's more volume there. There's more surface area. You do have to have some downtime though.
Yeah.
And this is the hardest part.
Some recovery.
It's some recovery.
Yeah.
It's 30 days, no sex.
Oh, that's not bad.
It depends.
That's doable.
Yeah, it depends.
I
on
mean,
the
some people
relationship.
might have a problem.
Right.
Right?
But
Some guys
nothing.
got a
But
problem.
nothing at all.
Nothing at
Not
all.
even with yourself.
No touching yourself.
Not even what you said.
Having erections at night are fine.
Yeah,
Right?
But no, don't use it.
No,
Okay.
because you're going to wrap it. And we wrap it like a splint on your arm.
Oh,
We
wow.
teach you how to wrap it.
Oh, okay.
Yeah.
Right.
So that's thickness. I tell guys, usually I'll increase you by 1 inch after one treatment.
Also, it's like multiples.
Yeah, you can do multiples. I have guys
Okay.
who had 3 treatments.
So does
Oh,
the treatments keep making it bigger? Or?
Yes.
Each time.
Each
Wow.
time.
An inch per session.
Typically an inch per session.
But hold up, per session, is it an inch or are they doing the thickness of it too?
No, it's the thickness.
Oh, that's just the thickness part?
That's just the thickness part. So
So every procedure,
you get more thickness. Now,
Oh.
are there procedures for length? Not so much. There are,
Okay.
but they're more invasive. So if you think about the anatomy of the penis, there's a ligament at the top called the suspensory ligament. It kind of holds it.
Yeah.
To lengthen it, they cut that ligament
Mm.
and pull out and can lengthen it maybe a half an inch if you're lucky.
How risky is that?
Very risky.
Yeah.
Maybe a half an inch. So I tell guys when I do this procedure, you're going to naturally look bigger because you're going to become more of a shower because it's going to be heavy
Oh, okay.
and it pulls out.
Yeah.
So you'll see that bulge in their pants.
sure,
sure, yeah.
Which guys
not a
want.
grower. Yeah.
The other aspect of this is not only can you focus on the shaft and the head, you can actually focus on the scrotum, the sack.
Mm-hmm.
You can make the sack bigger.
Wow. I didn't know all this, man. This
So
is
now
very
they've got all that
Yeah,
weight
now they
in
got
there,
that.
right? And so that's what they.
It's not like that whole shit where like they, you know how like women get like when their breasts are too enlarged and they start to have like back problems sometimes or back pain. Does that happen to the men?
You ever see those memes on Instagram where they're like, I got.
Yeah.
Right.
Yeah, that's what I'm saying. I wonder if you get like men are like it's like they're holding like
Or they
a
sit
kennel.
on,
You know?
Okay,
they're,
but-
they're sitting on their testicles.
So with the
Yeah,
lint,
that's
but
crazy.
with the lint, will that cause any after effects?
for the lengthening?
Yeah, if you
So if you cut that suspensory ligament,
Right.
the problem is, erections tend to be like that.
right, yours are just
Now they're hanging down.
They're hanging down. They can't get it
Too
in.
much weight.
Yeah.
Oh.
yeah. I wouldn't advise that one.
There's some pros and
Right.
cons here.
There's
with
pros
this.
and cons to everything,
Yeah.
right?
Right.
But with the thickness, you're still going to have that hard erection. You're
Mhm.
still going to be able to get it up. You're still going to have fullness. You need to have a discussion with your partner or partners about your size.
Right.
This is what can happen.
Mhm.
You become too big for them.
And they're not fond of it anymore.
No. And there's guys out there who go too big because they become obsessed with it.
Right.
Just like women and breasts.
And we'll get to that because I have some experience with the women with the breastises.
Oh.
Yes.
Yeah.
It becomes non-functional.
Yeah.
It just becomes a circus
Oh.
act.
Right.
And what are you
Dang.
doing it for?
Nothing at
Now
that
you're a
point.
clown.
You just
Yeah.
out here,
Man.
I guess, showing it around. I guess.
Right.
Yeah.
But I'll tell you, the biggest confidence for men when they're having relations with their person
Mhm.
is the confidence they get by showing it and also having intercourse,
Yeah.
right?
More work.
So
now.
that's ego. You're playing to their ego.
Yeah.
What does that do for their partner? The excitement and anticipation now
Mm-hmm.
of something bigger.
Yeah.
I've had patients who are sex therapists, female sex therapists. They'll tell you, what do women really want? They want to feel fullness inside them.
Yeah.
That's what they want to feel.
Yeah.
So men
sounds
need to
about right.
understand what their partner really wants.
Yeah.
They don't want this big, long thing
They don't
knocking
want
out the back of their cervix.
The 11-inch.
Yeah.
They don't
like,
want the Ocho
That's
Cinco.
not, there's not,
Well,
that's
some
not pleasurable.
people are born with that. They can't help that.
Right. There's some
Right,
guys who
right.
are cursed.
Right.
You
Right.
seen that one guy that, like years ago? There was like a video. He's like some dude from like South America or something.
Oh, yeah,
with
yeah.
The, yeah. Or I
He's
think-
got the longest
yeah.
in the world.
Yeah, it's like to the floor.
It's just,
And he's
yeah.
miserable. Like he looks like the most miserable.
I don't
guy
know
ever.
if there's reduction surgeries out there. I haven't
Probably
heard of
not.
those.
It don't even look like a penis.
I got
No.
a cousin that's cursed.
Damn,
Yeah.
There is
that's unfortunate.
there is
Like in
having
the
too
short
much.
way or the long way.
the long way.
It's just too
No
long.
homo.
Yeah.
Yeah, just that's how he was born. Though.
Yeah.
It's hard to accessorize.
So,
Wear
but is
certain
there
pants.
like a reduction? So, like, you know how you
I
lose
don't even know
weight?
if there's reductions out there because, again, you got to think of the anatomy. You can't really cut it off
Right.
Yeah.
because you pee out of that too.
Yeah.
You know?